I'm Stephen McCulley. I'm a consultant reconstructing anaesthetic surgeon. I'd like to talk to you a little bit about breast lift or mastopexy surgery. This is an operation that involves changing the shape or improving the shape of the breast but not changing the volume. So it's most suited to patients who have got drooping breast, empty breasts, and they're generally happy with the volume of their breasts but not of the shape. Now, you may have seen my breast reduction video, but if you haven't, the principles of mastopexy are very similar in that you keep the nipple alive on a tongue of tissue, but instead of removing breast tissue, you usually just remove skin, and you actually reshape the breast tissue to uplift it as best as possible. The scars are similar to breast reduction, that you can either have a scar around the nipple, down and underneath, that's the anchor-shaped scar, or more commonly actually, depending on the size of the breast, is the vertical type scar, which is a scar around the nipple and down. Now, this really is a relatively quick recovery operation. You'll be in hospital usually for one night. In my hands, the operation takes about 1.5 to 2 hours in terms of performing it, and you go home the next day and with really, on the whole, not usually that much discomfort. Saying that, you'd still want the equivalent of 1 to 2 weeks off work, and if you have a very active job, you might want even a little bit more. Now, the only important variation for breast lift is if we want to create more actual volume right at the top. Because even with the best will in the world, even if I lift up a very drooping breast and get the nipple more pert and get a much better higher breast on the chest wall, you still often end up with a little bit of scalloping at the top. The only way to get around that is to add an implant, and therefore an implant and a breast lift is called a mastopexy augmentation, i.e. a breast lift and a breast implant at the same time. Now, whether you need a breast implant will be discussed with you when you come to see myself or whichever surgeon you choose to go to. It is important, though, obviously you recognise that a breast mastopexy augmentation will create a larger breast and not keep you at the same volume, and then you do have some of the small but potential downsides of a breast implant. Are there any risks? Well, not a huge number, but as with any operation, there are things that can go wrong, and those include a small risk of bleeding, infection, wound healing problems, altered sensation on the nipple or the breast skin, slight differences between the two sides. And if you do have an implant as well, then there are the risks that go with an implant, such as infection or hardening, and the need to change that implant over time. So therefore, a successful operation, but it is important for you to understand that there are some differences whether you're going to just have the lift or with the implant, and we can go through that at a consultation. So whether you come to see myself or you choose another reputable surgeon near you, I wish you well with your breast lift operation.